Now we'll talk about the nursing care for older adults with chronic confusion in hospital or extended care facilities. Assess behavior on admission and at regular intervals. So yung tamang identification ng type of cognitive loss is very important para yung mga appropriate medical and yung mga nursing interventions natin ay ma-plan beforehand and ma-implement accurately. So, if na-notice na natin na there is a change in behavior in an elderly na normally wala namang problem with cognition, posibleng this is a physiologic problem and not chronic confusion. However, sa mga elderlies natin na may history na of cognitive changes, mas mahirap ito ma-identify. So, maaari nating ma-miss itong changes na to, kaya it is very essential to pay close attention to the subtle changes in behavior. Next, we will provide assistive sensory devices. So, yung confusion kasi, it is worse when there is inadequate or inaccurate sensory input. So, we as nurses must ensure and encourage sila to wear their eyeglasses, to wear their hearing aids, and dentures, ganon, and other adaptive devices. Itong mga assistive sensory devices na to kasi they're designed to maximize sensory perception when necessary. Then we will orient the person to person, place, and time, and provide any other important situational information. But do not force the issue because it can lead to agitation. So, we can accomplish this sa pagtawag sa kanila with by their name or what they respond to best. So, we could also show them yung mga calendars and clocks if meron silang questions regarding the day, the week, or yung month. So, yung calendars kasi, that can be referred when talking about important dates and events. So, kailangan nila ng constant reminder and at the same time, an explanation of procedures before it happens. Pero, if na-notice natin na they're becoming combative na or aggressive, we do not argue with them. Instead, ginagawa natin is we need to focus on their feelings and use reflective statements. Then, we will provide a structured environment that ensures safety yet enables the person to keep active as long as possible. So, we also need to keep the environment safe to prevent falls. So, meron ding mga elderlies na mas prefer nila na magsuot ng shoe sa kama, and this can be very beneficial kasi this can give them a better balance and footing when they need to get up. Next is we will provide continuity. So, on older clients, they can be disturbed or natatakot sila sa mga bagong bagay o sa changes, yung mga new phases, mga changes. So, whenever possible, care could be assigned sa mga consistent group of caregivers who can develop a trusting relationship with the patient. Very essential kasi ang rapport. So, maganda rin na the elderly has access sa belongings ng family niya like pictures or shirt or kung ano man yan na can remind them of their family or loved ones. Next is we will administer psychotherapeutic medications as ordered. So, a few medications are available to aid yung treatment ng cognitive disorders such as Alzheimer's disease. So, itong mga medications na to do not necessarily cure or reverse yung existing cognitive loss nila, but are very beneficial sa pag-improve ng memory nila, sa alertness, and sa social engagement. So, yung mga commonly prescribed include Tacrin, Donepezil, Galantamine, and Rivastigmine. Avoid the use of physical and chemical restraints. So, keeping confused persons restrained in beds or chairs tend to increase their level of confusion. So, very harmful to and could actually make the behavior worse. Nakikita kasi nila na yung mga restraints as a form of imprisonment. Actually, if these are used without valid medical reason, it can be grounds for legal action. Tsaka we need to remember na we're dealing with older clients, diba? So, rather than protecting them with restraints, this can be a hazard kasi this could lead to physical deterioration. And it is much more advisable to keep the bed in a low position or position a mattress sa floor to reduce yung risk nila for falls and injuries. Then, we will structure participation in activities of daily living, keeping routines simple and individualized. So, we can provide yung mga simple step-by-step directions para mas madali silang maka-keep up We can keep choices to a minimum para less yung confusion nila. We can also keep their clothing simple. Yung hair nila could be styled so that care is quick and very easy. And then we can keep yung meal times nila as pleasant as possible. Huwag sila pilitin. We can serve yung mga food like soup or beverages in cups with handles that are very easy to control. We could also prepare trays before serving to minimize yung delay and yung frustration nila. Then, we could also, yung toileting schedules nila, this can help reduce episodes of incontinence. Then, we can structure the environment to minimize disruption, avoid sudden changes of room or environment. So, na-mention na natin kanina na yung changes na to, this can frustrate and scare older patients. Yung mga frequent changes of staff and yung large number of strange people or new people, yung mga excessive noises natin and excessive amounts of activity, that can be overly stimulating sa ating patients. Kaya we should keep them to a minimum. And then develop a plan to deal with acting out behaviors. So yung excessive stimulation and stress can be very triggering sa catastrophic reactions nila or delusional behavior sa ating older patients. So making decisions and responding to questions are very stressful sa mga nagsasuffer from dementia, and that should be avoided. So as nurses, kasama din sa role natin to help them regain control. So, pwede rin tayo gumamit ng mga distractions to divert their attention.
Good afternoon, everyone. I will continue the discussion for caring for older adults with chronic confusion in hospital or extended care facilities. So, first is effective communication skills. So, bakit natin ginagawa to? This is to promote positive interactions with confused older adults. And kasama dito yung mga nonverbal cues natin na we always smile, and then we also apply gentle touch to them. Tapos, lagi natin alahanin, maintain eye contact. And then once we're communicating with them, give them adequate time. Allow them to express themselves, yung mga concerns nila, and yung mga gusto nilang i-share sa inyo. As much as possible, wag niyo silang i-interrupt. And then, while speaking to them, kapag sasagot na tayo, dapat short sentences lang, simple sentences. Always use layman's word. And dapat in a calm and natural tone lang. Like, malumanay lang. Huwag yung masyadong mabilis or yung parang nagmamadali sa pagsasalita. And next is consult with family and the multidisciplinary team. So, ngayon, the family can provide info kasi. May mga info kasing hindi nabibigay yung mga elderly patient natin since cognitively impaired sila. So, pwede natin i-ask yung family about yung mga likes ng elderly patient natin, mga dislikes, or yung usual routine nila sa bahay. And then the family can also recommend what worked in the past, yung mga ginagawa nila for their elderly loved one. And then, for the multidisciplinary team, it is very important na may collaboration tayo kasi pwede natin i-revise yung mga healthcare plan natin for the elderly patient. So, it is important na merong cross-information between the healthcare team. And now, I'm going to discuss caring for older adults with chronic confusion pero ngayon at home na. And the next point is help the family accept the diagnosis. Ngayon, it's very hard kasi to accept, for the family to accept na merong diagnosis si patient ng dementia or delirium. Pero as much as possible, we should encourage them na this is happening to their elderly loved one, and pwede natin ito magawa by actively listening sa mga concerns nila, syempre sa frustration nila kung bakit nangyari ba to sa loved one nila, sa mga tatay at nanay nila. Pero at the same time, kailangan din nating i-state yung mga facts and information regarding sa condition ni elderly patient para mas mapabilis natin yung acceptance nila for the diagnosis. Next is help them to adjust to provision of care for a cognitively impaired elderly. Yung family is usually mag-a-adjust for the demands ng care na ibibigay natin. And yung mga patient natin na may severely altered thought process, dapat hindi sila naiiwan mag-isa. So, yung mga families, usually dapat may naiiwan sa bahay, dapat may kasama, may nagbabantay sa kanila. Ngayon, pwede tayong makipag-collaborate with the family to supervise plan of care. We can help them, we can educate them about possible actions and yung mga behaviors na pwede nating gawin kapag magko-communicate tayo doon sa elderly loved one nila. And then yung mga effective techniques na alam nating possible na maging efficient siya kapag makikipag-usap na tayo doon sa elderly loved one nila. And then sometimes you can also do modifications sa bahay, such as yung mga edges or yung mga corners na masyadong medyo matutulis kasi baka mabangga nila yon. And then yung mga heavy objects or yung mga madalas nilang gamiting objects, pwede nating ilagay sa mga lower ground and huwag nating ilagay sa mga higher ground kasi baka tendency mahulog yun sa kanila. And then yun nga, since cognitively impaired sila, so mas madali nilang ma-misplace yung mga items na yun. So by putting them in lower ground or sa mga familiar places sila, ayun, familiar places para madali lang nilang maalala. And also kabilang dito yung mga promote din natin yung mga old hobbies nila if sa history natin or sa information na binigay ng family, let's say nagko-crossword si tatay dati or si nanay, pwede tayo mag-place ng mga newspapers sa lamesa tapos it could start something sa mga elderly loved one natin. Oh, may newspaper. So, maghahanap sila, magbabasa sila. So, it still promotes brain activity. Tapos, kapag nahanap nila yung crossword na mahilig nilang gawin dati, that can still promote brain activity and which can also improve brain memory. Next is provide emotional support and identify coping strategies. Ngayon, yung coping kasi ng family sa ganitong condition ng elderly patient is very stressful, lalo na sa day-to-day responsibilities nila. So, tayo as a nurse, kapag magvi-visit tayo sa home nila, pwede natin i-assess kung paano ba nagko-cope yung family, kung anong ginagawa nila to alleviate their stress kasi it's very demanding nga. Very demanding kapag may ganitong elderly loved one na may dementia or delirium. So we can talk about their concerns and their anxieties and just be an active listener for the family. And then the next point is identify and encourage to join community resources. Now, what are these community resources? Included dito yung mga support groups. Pwede tayong mag-encourage sa family ng elderly patient or pwede nating banggitin mismo sa elderly patient if hindi pa naman gano'n nagpo-progress yung cognitive impairment niya na maghanap sila ng support groups kasi itong mga support groups na ito nakaka-help to feel valid yung elderly patient and also it promotes social interactions. And as much as possible, i-encourage natin yung family na mag-join or samahan nila yung elderly patient kapag pupunta sila sa mga support groups na to. And then, meron tayong mga tinatawag na respite care programs. Ito yung mga temporary supervised care na halimbawa busy yung guardian or yung family natin and walang magbabantay sa elderly loved one or sa elderly patient. So, ito mga respite care programs, pwede nating dalhin yung mga elderly patient doon, tapos doon muna sila for a specific amount of time. Within the day, within 8 hours, ganun. Tapos, pwede na sunduin ng family ulit or ng guardian nila. Next is assist families to make arrangements for institutional placement if necessary. Ngayon, ito, parang mas longer version na ng respite care programs. Kasi 'di ba sa respite care programs is only temporary. Pero dito sa for institutional placement, minsan kasi may mga family or guardians na for them it is very demanding sa time kasi syempre may work din sila and they have their own problems and concerns and sometimes even sa mental health nila like psychologically exhausting for them. So, hindi na nila maalagaan yung elderly patient nila. So, minsan pwede nating i-recommend or i-refer na dalhin yung mga elderly loved one nila sa nursing home placement. Itong decision na to, medyo mahirap kasi alam mo yun, kapag dadalhin mo yung elderly loved one mo parang sa elderly home or yun nga, nursing home placement, parang magkakaroon sila ng feeling ng guilt and ng helplessness na parang tama ba itong ginawa ko? Parang tama bang nilagay ko yung tatay or yung nanay ko dito? So, as usual, we have to provide information and education sa kanila na if it is yun nga, it's very demanding for them, we have to be supportive for the family or the guardian na ganito na it really happens, especially kapag severely progress na yung cognitive impairment and ayun nga, masyado nang demanding sa physical and sa psychological well-being ng guardians or ng family. And next is encourage family for end-of-life decisions. Ngayon, we have to encourage the families to seek advice from their primary caregiver and the lawyer bago pa mag-progress yung cognitive impairment ng patient natin. So, itong intervention na to is as much as possible as early, pwede na nating ma-recommend sa mga families. And sometimes, severe na yung impairment ng elderly natin is kailangan na mag-hospice referral para ma-provide na talaga yung quality care for our elderly loved one. And finally, appropriate interventions that are usually used in the institutional setting. So, syempre, advisable pa rin naman na kahit at home, yung ginagawa natin sa institution or sa hospital, it is highly advisable na gawin pa rin natin at home kasi we want to deliver quality care sa ating patient. And here are some examples. Magandang hapon po, Sir Andre. Kumusta po kayo?
Okay naman.
Okay naman po. Opo, okay. So, ano pong ginawa niyo po ngayon?
Nagbasa-basa lang.
Nagbasa-basa po kayo. Oh, ano po yung mga nabasa niyo mga news ngayon?
May sunog daw doon.
Ganun po. Opo, nabasa ko nga rin po na may sunog po doon sa San Andres kahapon.
Oo,
Opo.
nabasa ko nga eh.
Kamusta naman po yung mga support groups niyo po?
Nag-attend naman.
Naka-attend kayo kahapon. Talaga po. Sige po. Mabuti po yan. Makakatulong po yan sa inyo po.